Hi class, in today's speech, we're going to talk about how vaccination should be required for all children before enrolling in school. Depending on each school and state policies, children may not be able to attend their first day of school until they are fully vaccinated. In an attempt to reduce common illnesses and eliminate potential fatal or harmful diseases, medical leaders have created mandates that command all kids to be vaccinated. Students who are not vaccinated are susceptible to an array of health issues. First, I will talk about how getting the vaccine helps protect children. Then I will discuss how immunization requirement is the most efficient method of herd immunity. And finally, I will discuss how vaccine saves lives. First, let's get into how getting the vaccine helps protect children. According to CNN News, by the time a child is 2 years old, he or she has most likely been injected with over 20 vaccines to prevent various health problems. Aligning with this early treatment method, most public schools demand that all children are vaccinated for common child-related sicknesses, including vaccines to prevent illnesses such as mumps, measles, chickenpox, flu, meningitis, and tetanus. In addition to a wide spectrum of other potential preventative vaccines, the Center for Disease Control and Prevention asserts that immunization regulations must be enforced to protect all children in society. Ultimately, with the support of vaccinations, medical leaders along with CDCP believe that optimal immunization against illnesses is the best way to prevent a widespread breakout of common contagious diseases. Since children are forced into a small classroom area with countless physical interactions each day, experts assert that regulations help to keep each child safe and healthy. After examining how getting vaccinated helps protect children, we can take a look at how immunization requirement is the most efficient method of herd immunity. Herd immunity is present in a community when such a high percentage of its members have been immunized from a particular disease that the disease cannot gain a foothold in the community. Therefore, achieving and maintaining herd immunity protects not only those who have been vaccinated, but also those with compromised or weak immune systems, such as the elderly, babies, and those afflicted with HIV. Since achieving herd immunity is an inherently preventative measure, mandating school vaccinations as a method of perpetuating herd immunity is far less costly for governments, healthcare providers, and the economy than treating victims of a disease after it has appeared in a community. The preventable 1989-1991 measles outbreak in the United States, for example, created $1 million in direct medical costs alone. Herd immunity, then, is not only the most efficient method of preventing illness and human suffering, but also the most cost-effective. Now that we understand how immunization requirement is the most efficient method of herd immunity, we can discuss how vaccine saves lives. The American Academy of Pediatrics states that most childhood vaccines are 90% to 99% effective in preventing disease. According to United Nations Foundation partner organization, vaccines save 2.5 million children from preventable diseases every year, which equates to roughly 285 children saved every hour. The Center for Disease Control estimated that childhood immunization prevented about 419 million illnesses, 26.8 million hospitalizations, and 936,000 early deaths of children born between 1994 and 2018. The measles vaccine has decreased childhood deaths from measles by 74%. Let's move on to conclusion. First, I talked about how getting the vaccine helps protect children. Then I discussed how immunization requirement is the most effective method of herd immunity. And finally, I discussed how vaccine saves lives. Students who are not vaccinated are susceptible to an array of health issues. Choosing not to vaccinate could potentially affect the monetary health of your family. forcing parents to take time off work and pay expensive medical treatments. Hopefully, by listening to this speech, persuade you to get vaccinated. Thank you.